Welcome to the FAB Center for Innovation 21st Century Learning Community Interview Series. I'm your host, Reno. In each video, we hear from public health leaders about their work in public health transformation and what they've learned. In this episode, we discuss how public health practitioners and leaders in Indiana and Nevada worked with state lawmakers to address public health needs. Joining me today are Pam Pontones, Deputy Health Commissioner of Local Public Health Services at the Indiana Department of Health, and Megan Comlossy, Director of Public Affairs and Policy for the School of Public Health at the University of Nevada, Reno. Thank you both for being here. Pam, why was the Governor's Public Health Commission established in Indiana?
Governor Eric Holcomb established the Governor's Public Health Commission in August of 2021 to review Indiana's public health system, especially with the effects of the COVID-19 pandemic, exacerbating some of our longstanding public health issues here in Indiana. So the commission reviewed Indiana's public health system, which includes the Indiana Department of Health, our 95 local health departments, healthcare systems, community partners, along 6 different areas, including governance, infrastructure and services, workforce, funding, data integration, childhood and adolescent health, and emergency preparedness.
Can you tell us about the Health First Indiana program?
The Health First Indiana initiative is the implementation of the 32 recommendations that the Governor's Public Health Commission set forth in its report. That implementation also includes the use of the state appropriated funding through our legislature in April of 2023, specifically to support public health for local health departments and the Indiana Department of Health. The implementation includes the building the capacity through local health departments to provide a set of core public health services outlined in the legislation passed by the General Assembly, with the goal that every Hoosier, no matter where they live, can receive optimal public health services in every single county.
Why was a locally focused transformation process important in Indiana?
Indiana is a decentralized state for public health, which means that the county or city health department has the legal authority and jurisdiction over all public health issues. Those local health departments do not report to or answer to the State Department of Health, but they are their own entity over public health issues in their communities. The beauty of the funding is that it is very flexible. So local health departments, in collaboration with their local elected officials and community partners, can decide where they feel the funding is most needed to provide those core public health services. It's not anticipated that all local health departments will provide for all of those core public health services themselves, but are really encouraged to utilize community partners as well to be able to provide for core public health services in their communities and essentially force multiply what the local health department can provide.
Megan, leaders in Nevada also have been working to get increased funding for public health. Tell us about the recent legislation that was passed and what it could mean for public health in your state.
Absolutely. So in 2023, the Nevada State Legislature passed Senate Bill 118, which appropriated $15 million in state general fund dollars to the state's Division of Public and Behavioral Health to allocate to local public health authorities to improve public health statewide. The $15 million is about $5 per capita. And it's supposed to be allocated to public health districts based on population. And for counties that don't have health districts, the funding is going to the Division of Public and Behavioral Health or its designee. So the idea is that entities that receive the money are going to evaluate public health needs in their jurisdictions, prioritize those needs, and then spend the money in order of the priority that's identified.
Can you explain how your team was able to make the case for funding?
One of the tools that helped us make the case for additional public health funding in Nevada was a better understanding and awareness of what foundational public health services are and why they're important. And this understanding was among public health partners as well as legislators and other policymakers. Having just come through the worst of the COVID-19 pandemic, everyone better understood what public health was, what it involved, how it affected people, how it affected communities. And so we were able to use that messaging to garner support for additional funding. We also used new reports that had come out just before the legislative session with data about the public health workforce and workforce shortages, how the pandemic affected those, and that type of information to better make the case.
Do you have any advice for others who are in the process of pursuing additional public health funding for the foundational public health services?
Absolutely. One of the things that we've learned through participating in the 21st century learning community is that states that have successfully pursued public health funding have had a high-ranking, influential champion or champions in the legislative and or executive branch. And that's a really critical piece to this puzzle. It's also really important to do some groundwork to develop the support that you need, not just within public health, but outside of it. Need to explain to partners and non-traditional partners across all of the sectors that public health touches what public health is, why it's important, how it aligns with their goals and what they're doing, so that you have a critical mass who comes to support this type of legislation. And that's not even to mention all of the work that needs to be done with the policymakers who are making the decisions themselves.
Thank you both for being with us today. You can visit the show notes for more information on how legislative action in Nevada and Indiana has moved public health transformation forward in those states. On behalf of everyone at the Fab Center for Innovation, thank you for watching.